The Assisted Dignity Act, a compassionate approach to end-of-life and mental health rights. Preamble. In recognition of personal autonomy, the reduction of unnecessary suffering, and the moral obligation of society to support individuals in crisis, this act establishes a legal framework for assisted dying for individuals facing unbearable, irreversible suffering, whether from terminal illness or long-term treatment-resistant depression. This act is designed to minimize suffering while ensuring every possible alternative is explored first, provide safeguards to prevent impulsive decisions, use data from cases to improve mental health and societal well-being, acknowledge the dignity of individuals who have exhausted all options. Section 1. Eligibility for assisted dying. A person may apply for assisted dignity procedures if they meet one of the following criteria. 1. Terminal illness with severe suffering. Must have less than 12 months to live as confirmed by 2 independent medical professionals. Must be experiencing severe, unrelievable pain or extreme distress. Must provide consistent, repeated requests over a 3-month period. 2. Long-term treatment-resistant depression. Must have been diagnosed with severe chronic depression for at least 10 years. Must have undergone all reasonable treatments, including therapy, medication, and alternative approaches. Must have had intensive mental health support for a minimum of 2 years before application approval. Section 2. The mandatory support and reflection process. 1. Comprehensive evaluation. Applicants undergo a multidisciplinary assessment including psychiatric review, neurological evaluation, social and environmental factors analysis. 2. Mandatory treatment and intervention period. If applying due to depression, the applicant must engage in at least 2 years of additional treatment efforts, including community support programs and social reintegration efforts. 3. Data collection for societal improvement. Every approved case must include a comprehensive report analyzing why the system failed the individual. Reports will be used to improve mental health policies, funding, and community support programs. The goal is to reduce future cases through better mental health support and societal reform. 4. Final reflection period. Before final approval, individuals must confirm their decision at 3 separate points. A 6-month final waiting period ensures non-impulsive choices. Section 3. Protection against abuse. No approval for impulsive cases, for example, those experiencing acute depressive episodes without long-term history. Strict oversight by medical and ethical review boards. No coercion or external pressure allowed. Applicants must self-initiate the request multiple times. Family and community involvement to explore alternatives. Final thought. a brighter future through compassion. The Assisted Dignity Act is not about encouraging death. It is about ensuring that suffering individuals receive every possible chance to heal. If all else fails, they are given the dignity to make their own choice. This act also forces society to reflect. Every assisted case represents a failure in our system, pushing governments and communities to do better. This is not about death. It's about life, dignity, and accountability.